Adrenergic or sympathomimetic drugs are agents that mimic the actions of the sympathetic nervous system by stimulating adrenergic receptors. They produce physiological effects similar to those of adrenaline and noradrenaline, such as increased heart rate, bronchodilation, and vasoconstriction. These drugs are classified according to their therapeutic uses, and the entire classification can be easily remembered using the quick recall mnemonic. Norepinephrine do press my mind, where NE stands for pressor agents that raise blood pressure. Aid the heart represents cardiac stimulants. I stars breathing indicates bronchodilators. All drugs make mindactive refers to CNS stimulants. Relaxation in stressed tummy denotes uterine relaxants. Opens nose extra please represents nasal decongestants, and stops a fat diet stands for anorectics. The first group, pressor agents, are drugs that raise blood pressure mainly by causing vasoconstriction through alpha-adrenergic stimulation. They can be recalled by the mnemonic NE do press my mind, where N stands for noradrenaline, E for ephedrine, D for dopamine, P for phenylephrine, M for methoxamine, and mephentamine. These drugs are clinically used in the treatment of hypertension and various forms of shock, as they help restore vascular tone and blood pressure. The next group includes cardiac stimulants, inotropic drugs, remembered by the mnemonic aid the heart. This represents A for adrenaline, I for isoprenaline, and D for dobutamine. These agents enhance myocardial contractility, increase cardiac output, and are used in cardiac arrest, heart failure, and AV block to support or restore cardiac function. The bronchodilators, beta-2 agonists, form the third category and can be easily remembered by the mnemonic I stars breathe. It includes I for isoprenaline, S for salbutamol, T for terbutaline, S for salmeterol, F for formoterol, and B for bambuterol. These drugs act by relaxing bronchial smooth muscles, producing bronchodilation, and are therefore widely used in the management of bronchial asthma and chronic obstructive pulmonary disease, COPD. The fourth class is CNS stimulants, which are drugs that increase alertness, attention, and energy levels by stimulating the central nervous system. They are remembered by the mnemonic all drugs make mindactive, representing A for amphetamine, D for dexamphetamine, M for methamphetamine, and M for methylphenidate. These agents are used in the treatment of narcolepsy, attention deficit hyperactivity disorder, ADHD, and as appetite suppressants, although misuse can lead to dependence. The fifth group consists of uterine relaxants, tocolytics, which are drugs that relax the uterine smooth muscles and help delay preterm labor. They can be recalled using the mnemonic RIST, that is relaxation in stressed tummy, where R stands for ritodrine, I for isoxaprine, S for salbutamol, and T for terbutaline. These beta-2 agonists inhibit uterine contractions and are used to prevent premature delivery and provide uterine relaxation. The sixth class, nasal decongestants, includes agents that relieve nasal congestion by constricting nasal mucosal blood vessels. They are remembered by the mnemonic open nose extra please, which includes X for xylometazoline, O for oxymetazoline, N for nafazoline, P for phenylephrine, and pseudoephedrine. These drugs are used for nasal congestion, allergic rhinitis, and sinusitis, as they reduce mucosal edema and open the air passages. Finally, the anorectics, appetite suppressants, are drugs that decrease appetite and are used for the short-term treatment of obesity. They can be recalled using the mnemonic stops a fat diet, which includes A for amphetamine, F for fenfluramine, D for dexfenfluramine, and S for sibutramine. These agents act on the hypothalamic appetite centers to suppress hunger, but their long-term use is limited due to potential adverse effects. In conclusion, Adrenergic or sympathomimetic drugs play a vital role in managing several clinical conditions involving cardiovascular, respiratory, central nervous, and reproductive systems. The use of simple recall mnemonics such as norepinephrine do press my mind, aid the heart, I stars breathe, all drugs make mind active, relaxation of stressed tummy, open nose extra please, and stop a fad diet makes understanding and remembering the classification easy and systematic for both students and practitioners of pharmacology.